Okay, let's move down the shaft, the main body of the bone. It changes shape, doesn't it? More round up top, then kind of triangular lower down.
Yeah, it does transition. And on that shaft, about midway down the outside surface,
Yeah.
there's a rough patch called the deltoid tuberosity.
Ah, for the deltoid muscle, the big shoulder muscle.
Exactly. That's where that powerful muscle inserts. It's what lets you lift your arm out to the side, abduction, a really key anchor point for power.
And on the back of the shaft, there's that spiral groove, the radial groove. What's significant there?
Oh, very significant. It's not just a groove, it's a pathway. The radial nerve and the deep brachial artery, the profunda brachii, run right along in that groove.
So if you fracture the midshaft?
Exactly. That nerve is really vulnerable. Damage it, and you get wrist drop. You wouldn't be able to extend your wrist or fingers. Yeah. It really highlights how anatomy dictates potential problems.
Okay, down to the bottom end then, the distal part forming the elbow. It looks flatter. You've got the capitulum for the radius and the trochlea, like a pulley for the ulna. What allows the hinge motion but also stops it going too far?
It's the fossae, these depressions in the bone. On the front, you have the coronoid fossa and the radial fossa. They receive parts of the ulna and radius when you bend your elbow fully. And on the back, there's the big olecranon fossa.
For the olecranon process of the ulna.
Right. When you straighten your arm completely, the olecranon slots into that fossa. These fossa basically act as bony stops, preventing hyperextension. They define the range of motion.
Now, this area is also famous for the funny bone sensation near the medial epicondyle, that prominent knob on the inside.
Yes, and the aha moment here is that you're not actually hitting the bone itself. The medial epicondyle is a major attachment point, for the forearm flexor muscles. But right behind it, in a groove, runs the ulnar nerve. It's very superficial there.
So when you bang it,
you're compressing that nerve against the bone. That's the zingy, shocking feeling. It's the nerve protesting. And by the way, the bump on the other side, the lateral epicondyle, that's the main attachment for the forearm extensor muscles.
Wow. Okay, so we've gone from seeing just a bone, the humerus, to understanding it as this intricate structure, its shape, those tubercles, grooves, fossas, they all dictate exactly how your arm can move and where it's vulnerable.
Absolutely. And maybe a final thought to leave you with. Consider development. The main shaft of the humerus starts forming really early, like the 8th week in the womb. But the ends, the head and tubercles, those crucial secondary centers, they don't fully fuse onto the shaft until around age 20. Think about what that staggered development means for, say, shoulder joint stability and injury risk throughout childhood and adolescence. Quite profound.